Welcome to Local Doctors on Call. I'm Grant Boxleitner. Our topic is holiday illness. Our guests are Kevin Pierce and Dr. Kim Caparelli. And let's start, welcome to the show first of all, but let's start by getting to know you, a little bit of your background and where you're from.
Well, thank you. Well, my background is in mostly hands-on modalities with massage therapy and then also in education. I've actually grew up in Sarasota. I know the area well.
Yes.
Left the state for a little while, but now I've come back to work as the academic dean at East West College.
Yes, and you?
Well, I actually grew up in Ohio, moved to Florida a long time ago, so I guess I'm a Floridian. I was an educator and then a speech-language pathologist, and then decided to get my degree in Oriental medicine. And now I teach at the college and have an active practice also.
And for folks who don't know, where is the college?
We are on North Tamiami Trail, just north of downtown Sarasota.
All right, well, let's dive into this topic if we can. With the cooler weather coming, I know winter is on its way, even though it doesn't necessarily feel like it around here yet. There's always an increase in colds and flu, but does traditional Chinese medicine or massage therapy help address these issues?
Well, in regards to traditional Chinese medicine, yes. It will actually build the immune system, because with a lower immune system, you actually have more colds and flus, and you get run down.
Right.
And so acupuncture and herbal medicine can help. And Kevin, you can talk about how massage can help too.
Sure.
Absolutely.
Yeah, well, massage therapy is preventative mostly, not necessarily in treating conditions once they've already happened, but
Right.
massage therapy is more about addressing the stress, the tension that we carry day to day, and allowing people to just relax and deal with stress more on that daily basis. Pain, stress, and those things this time of year can certainly compile what would normally be a very happy time, but massage is more preventative for relaxation and stress relief.
Absolutely, and also maybe taking an individual approach with each patient, seeing what their needs are.
Right,
Is that something that you'd recommend?
And that would be, you know, how we as Chinese medicine practitioners actually look at a patient. We look at the whole constitution of the patient, and we look at individual approach, the holistic approach.
Absolutely. All right. Well, what are some ways that maybe Chinese medicine, acupuncture, or massage therapy differ in the approaches with things like, let's start with colds first of all.
Well, I think that instead of a one fix for everyone, we actually look at the person, like I said before, and look to see, you know, whether they have a weakened immune system. Are they going into the season with a weakened immune system? And then we look at whether they have whether they're susceptible to getting a flu or a cold or a sore throat.
So this is different than the Western medical approach?
A little bit, yes, because, you know, you're doing it all individualized.
And Kevin, did you
Yeah, within massage therapy, we also take a very individualized approach. Most of the time, what you see with treating someone in a, quote, Western approach,
Right.
People think of, you know, popping a pill, the one-time approach. And I think with massage therapy, along with the traditional Chinese medicine, it's definitely more preventative. We look at the individual day-to-day lifestyles, and we try to address things that, of course, are conditions that would be a result of that, but also try to address things that may be get ahead of the game. You know, try and look at how we can strengthen somebody's ability to rest better, to manage stress better, maybe live a little less pain with regards to maybe an injury or something that they may be dealing with, so that they can go forward and deal with stress better.
And even help maybe managing their day-to-day lives.
Exactly.
And things like that.
Yes, exactly.
Okay. All right. So is this to enhance, like if someone gets a cold, maybe they want to take some over-the-counter medication. Would this approach enhance that, or what do you recommend?
With the massage therapy, we actually would recommend that they go see their primary care, because we don't want to address someone specifically if they have what's known as an acute condition. Massage therapy would help to promote blood flow, lymph flow, which can aid in the prevention of a perhaps bacterial infection.
Right.
But if they're actively dealing with an infection, we wouldn't want someone to get massage therapy at that time. It could aggravate it. But that's not to say what the acupuncturist wouldn't do.
Right. Well, in traditional Chinese medicine, we might look again at the individual person. We would look at their signs and symptoms, and we would look at their lifestyle, and then we would actually design something for them, a plan of care, whether it be herbal medicine or acupuncture.
And how long, for instance, if someone did come in that wanted some treatment to address these issues, how long would a typical treatment last? Are we talking an hour? Is it a course of days? Give us a sense.
Okay, so if someone comes in to, like, say, this clinic at East West, we would do an evaluation, and then we would do treatment. So the first treatment's a little bit longer, maybe in 45 minutes to an hour, and then follow-up treatment would be 30 minutes to 45 minutes. And during that time, we would treat that patient 1 to 2 times a week.
Okay.
And they can come in up to 5 times a week. You know, in China, that's how the patient's treated.
I see. All right, so for the flu, which typically can be a little bit more severe, the same approaches, or do you differ in some way from the colds?
For massage, it would be basically the same. We first, of course, would evaluate the individual based upon their immediate condition,
right,
and then determine what their plan is. If they're currently taking medication, if they're currently on an existing healthcare regimen, we could plan something with massage. But typically, if someone again is in that acute stage, we're going to refer them to someone who's going to address those more on a medical standpoint, such as like Dr. Caporale was saying.
Right, and so for flu, obviously you want to make sure that the person's not contagious, I assume, and taking precautions if they're coming into your
Right.
college.
But I think we treat contagious people too. I don't think that, you know, I mean, but I think a flu treatment would be a little bit a stronger treatment than a sore throat.
In what way? Is you would do a little bit more treatments?
A little bit. The same treatment times, but just a little bit different approach, because they might be running a temperature. It would be a different approach than that patient that's not running a temperature. And that's not saying that we don't integrate our medicine at all. You know, if they need an antibiotic, they need an antibiotic. But we surely can help.
Sure, absolutely, enhance. And during the winter months, do you typically see more volume? Do more people come in, just in terms of the volume of people here, which is more, and also some of these illnesses that you see?
I think we do in the clinic. We see much more people during the winter months and during the flu season.
So from about October through April, it will be kind of your
yes, I think so.
periods or something like that?
Yeah, absolutely. And also, just as people tend to deal with more during the holidays, it's an opportunity for them to maybe take a break, come in, get some treatment, and I think it's also a time when people are also looking to maybe reduce some of that stress, and so that's another, contributing factor to the increase in volume.
Yes, and you know, if you have time off over the holidays, or you're looking forward to 2016, maybe making some goals, this might be something you want to consider.
Absolutely, yeah, definitely.
All right, anything else that we want to add before we move on from this? Fascinating topic so far.
Not at this time. I just think people definitely should pay attention to what they're dealing with on a day-to-day basis and consider the alternative therapies that are available to them, specifically acupuncture, traditional Chinese medicine, and massage therapy. If they haven't considered it, it is a very powerful tools that they can use in preventative medicine, especially this time of year.
Yeah, and with the holidays we just talked about, there's an increase in stress. A lot of people are planning, people are shopping, they have family in town. That could potentially be stressful, but I don't want to judge anybody. But can people benefit from the medicine, the Chinese medicine, the massage therapy, when they're dealing with all of that stress?
For massage therapy, for certain. One of the main things that people are seeing with massage therapy is that it's becoming more commonplace in a person's individual health regimen. Massage therapy has become recognized in multiple venues, both medical and also in what would be considered relaxation style, sports medicine, all sort of things, resorts. And so it's becoming recognized in such a way that people are going to use it more and more. One of the best benefits is the ability to reduce stress and pain together, which allows people to sleep a little better.
Right. I was going to say promoting better sleep.
Yeah.
Sounds like a good thing for a lot of people.
Absolutely. You know, we deal with stress in different ways. Some people carry it in their shoulders. We have headaches, back pain, and a lot of times, you know, that prevents us from getting a good night's sleep. And, you know, we buy mattresses and pillows and all sorts of gadgets, but oftentimes, you know, the challenges are actually just musculoskeletal and releasing tension, reducing pain, both with acupuncture and with massage. Pain management is one of the biggest things people can do to help promote healthy sleep.
Well, we are going to continue that in one moment, but don't go anywhere because there's more local doctors on call right after this.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back. We're talking about holiday illness, and Kevin Pierce and Dr. Caparelli are here from East West College of Natural Medicine. And when we last left off, we were talking about stress and dealing with that. The acupuncture and Chinese medicine approach, talk about that.
Well, you know, Chinese medicine has always been noted to relieve stress, no matter what you have.
Mm-hmm.
You know, if you have pain, you have stress. If you have a disease, you have stress.
Mm-hmm.
You have stress financially. I mean, there's a lot
So
of
many
different things.
factors,
Right,
sounds
right.
like, can lead up to this.
Right, and especially during the Christmas season, you know, financially, you're just whipping out that charge card, you know, and then all of a sudden, when you're
you
still,
see the bill?
yes, when you're still, all of a sudden you have stress, or even fighting the crowds,
Right.
or the kids. You know, what am I going to buy the kids?
When are you going to have time to get everything done?
Exactly,
It all leads up to
exactly.
that. Now, as far as pain management, you know, you would mention the massage therapy is a good way to approach that, because stress and pain can sometimes go hand in hand, right?
Mm-hmm. Absolutely. Well, within massage therapy, one thing we often see is an existing or pre-existing condition, maybe an injury or from an accident. In my own personal experience dealing with individuals who may have had accidents, whether it be at work, in the car, or any sort of venue, they may have had it treated, but years later the body will compensate, and when they get stressed or when they get tired, it'll flare up. So these reoccurring issues can also be things that pop up during the holidays, as people will say, you know, oh, my knee or my back or my headaches are coming back.
Right.
And stress can aggravate things.
Yeah.
And so we try to educate our clients and let them know, you know, these pre-existing conditions can be something we can address. We can try and resolve some of them, and then that will help to just address pain in general.
Yeah.
And oftentimes that can show many benefits and sort of a ripple effect.
Yeah, and even help the body relax.
Absolutely. Absolutely.
And that is key. Now, what about diet? I know a lot of this, people say that the diet can help with a lot of things. What's the approach at the college when it comes to diet?
Well, we counsel our patients on diet because it reduces, you know, if you eat the right kinds of things, it reduces inflammation in the body. And once you reduce inflammation in the body, you reduce disease. And whether it be cold, flu,
Right.
Any other kind of disease that might present itself.
We always hear about, you know, make sure you get your vitamin C. It can stave off a lot of things, or even know these other sayings.
Exactly.
Are these things to keep in mind? What are some good foods, I guess, to kind of embrace?
I think greens and,
Okay.
and reducing dairy and reducing sugar in your diet. I think that's huge because both
Reducing
those,
it completely or limiting it?
in moderation, we always say.
Yes.
You know, because a lot of times you can say, oh, well, go on this diet, but
Yeah.
then what does it add? It adds stress. And then again, it's like a snowball effect.
Right, and then you're back to, you know,
Right,
catch-22,
right.
if you will. All right, well, when we talk about diet, that can also lead to a weakened immune system, but what else could potentially cause your immune system to be compromised?
Well, stress, like we said, we've been harping on stress a lot. Overwork.
Right.
And lack of exercise, huge lack of exercise, because there's a research that shows that people go something like 75% less to the gym during the month of December. And then, of course, then they start out in January. We all have that.
Everybody wants to get that new drive
Exactly,
and the new resolution.
exactly, yes.
So make sure that even if you get a little time, I mean, even as much as walking, what do you
Right.
do you recommend?
Well, you know, they're not going to go to the gym, and because a lot of times the kids are home, right?
Right.
So anyway, just they're going to have to go to the malls to shop. So we just say take a few laps around the mall, walking fast.
I've also heard maybe park way out there so that
Yes,
you get a
that's
nice
right.
walk on the way up to the mall.
Yeah,
Things
it's
like
always
that.
recommended to pay attention to how much activity you're doing on a day-to-day basis.
Right.
I know there's a lot of new electronics out there to promote that, but it's definitely beneficial. Pay attention to your activity level. Work to incorporate extra steps or extra activities. Monitor the amount of food. Portion size is another big thing too.
Do you recommend apps to the clients? I know some of them keep track of your steps or your food or your calories. Is that something that you...
Not individually, it's just based upon what your goal is. If you have a
Okay.
specific goal, then you can address that with a particular product or basically just day-to-day activities, increasing your activity
Right.
level, monitoring what sort of activities you're doing, and maintaining that elevated heart rate is really one of the most important things that can help to reduce stress and to overall increase health.
Also heard if you work on maybe a second or third floor or fourth floor, perhaps consider taking the stairs. It really kind of gets
All
your
the
heart
time.
rate up. And
Making a habit of things in that nature really promotes a general sense of healthy habits, healthy lifestyle, incorporating more activity, better diet, stress relieving. All these things need to be incorporated in a normal monthly, if not weekly, health regimen.
fair to say that when your immune system is firing on all cylinders, it's probably pretty rare that you would even get the flu or a cold.
I would say so.
I would say so too.
And so preventative treatments like you're talking about can really help you go a long way into making sure that immune system is as healthy as it can be.
Right, right. We have a lot of patients that come in the clinic and they get supplements or Chinese herbs to just build their immune system,
Right.
and then they don't have to deal with the flu and cold or cough or sore throat.
Are there supplements that you recommend generally, or is it a case-by-case basis?
I think it's a case by case, but we have this wonderful array of supplements and vitamins and Chinese herbs, of whatever. It just fits in the lifestyle. That's huge.
Is it kind of a little pharmaceutical area at the college, or where do people go
Yes.
to see this?
Right there.
Yeah, the college actually has an herbal pharmacy on site, which is something that many schools don't have. So
Okay.
it is something that if you come in, and as a patient in the clinic, it is advised that you can take a supplement based on the herbs.
Right.
We are able to use a herbal pharmacy right there that is prescribed by the physicians on staff.
So then you would go there, you'd fill it. Now, for people just maybe coming there for the first time, are they allowed to just browse there and see what they may want to take, or do they need a consultation first?
They need a consultation first.
Okay.
But they can, if they don't want acupuncture, they can just come in for the herbs. If they don't want massage at that point, they can just come in for the herbs or supplements.
But
We
they
have-
would meet with one of the professionals before that would occur.
Mm-hmm.
Absolutely.
Okay. So getting back to acupuncture here, where would you put the acupuncture needle, let's say, if you had a cold, for instance?
Well, there's a beautiful points with a lot of research behind it on the top of the hands, and
Okay.
also the wrist point, and then also in the bottom of the hands into the inside of the wrist, and very, very tiny, tiny needles, as thick as a hair, and are placed. So it doesn't.
And for people, so if it is that small and tiny of a prick,
Right.
is it something that they're barely going to feel?
They barely feel it. I have a lot of pediatric patients, and so we put those little teeny needles in them. They like it. Those kids like those little needles, and they think it's cool.
So as far as the flu, is it the same, or does it depend on?
Still depends on the patient,
Okay.
because the flu can present itself in all different manners and ways.
Absolutely. And hands and wrists and the tiny needles, but for different other patients, would you go beyond that and maybe use larger needles?
Larger, but maybe longer.
Longer.
But not thicker.
Not thicker?
Yeah.
Okay. And how long does it take, like say you needed hand treatments because you had the cold, how long would something like that take, and how long would you keep the needles in?
We retain needles about 20 minutes, 25 minutes. And so, from start to finish, from walking in the door to walking out the door, it's about 45 minutes.
And are they seated or are they lying down during this procedure?
Mostly at the clinic, they're lying down.
Okay. And music, I'm assuming they're as relaxed as they can be.
Oh yeah, music, dim lighting,
Yes.
warm beds, you know. Yeah.
Conversation too, do they ever bring people with them, or is it the professional in there?
It's usually just they're in there all
By
by themselves usually, yes.
Okay,
They
so-
could bring somebody
Yeah,
with
if
them
they
to
wanted
sit,
to,
sure.
maybe,
Sure.
All right, and no apprehension. I'm sure the clients who've been there a while are used to this and look forward to it. But do you get any apprehension for the first time?
I think so.
Yeah.
That has never had acupuncture. Just think about it. You know,
Yeah.
you have
The
needles
imagining
stuck.
the
you know,
needles.
right. They think they're hypodermic needles, and which they aren't. They're just very, very little thin needles.
All right, well, stay right there because there's much more local doctors on call right after this.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Welcome back to Local Doctors on Call. I'm Grant Boxleitner. Our guests this half hour have been Dr. Caparelli and Kevin Pierce of East West College of Natural Medicine, and we've been talking about holiday illness, and a fascinating topic. And as far as flus and colds, that's kind of what we've been focusing on. Are there methods that could be included in a traditional Chinese medicine approach? We've kind of gone over some of that, but I guess it's a lifestyle.
I think so, right, Kevin?
Yeah.
I mean, it's definitely a lifestyle.
Yeah.
With diet and reducing stress, like we just said, you know.
Boosting the immune
Boosting the
system,
immune system.
yes. And even the diet,
Right,
healthy
which
diet.
reducing inflammation in the body.
Yeah.
And you had mentioned earlier sugar and dairy, things to potentially stay away from or limit.
Right. And massage will address the lymph system.
Yep, and massage therapy has something that I didn't mention before was
Right.
there's multiple types of massage therapy, and so a lot of times people think massage is just one thing. It's
Right.
a relaxation. But within massage, as well as with any allied healthcare, is you've got multiple approaches. Some
Sure.
people want to have a more integrated approach, which would be something like a shiatsu, which is something that you're going to see both traditional Chinese medicine practitioners as well as massage therapists doing. Also, there is flexibility, range of motion, stretching, deep tissue, neuromuscular, lymphatic drainage, numerous types of massage that are available out there that can address not only stress, but also very specific conditions.
And can massage therapy also increase blood flow, which can in turn, I guess, help a patient too?
Absolutely. Blood flow is one of the main things that is addressed by massage therapy. Through the manipulation of soft tissue, it increases the fluid movement of interstitial, which is between the tissues, which is ultimately what will help to move the lymph, which has a huge role in immune systems. Also, increased circulation helps promote the oxygenation and the flushing, if you will, of tissues, which helps to reduce stagnation in the tissues and waste buildup, sometimes like lactic acid or things of that nature. So it's really a useful, I call it modality, but it's really a useful tool, for lack of a better word, in somebody's normal stress-reducing regimen.
And you know, we're in Florida, so I don't even know how many people own a scarf, but can a scarf be used to protect people in some way?
Absolutely.
Oh yeah, definitely. It's really a fun joke around acupuncturists. You'll see all the acupuncturists wearing scarves because.
And I believe you're wearing
yeah, I have a scarf
today.
too. You know, but when in Chinese medicine the flu, cold, whatever is invasion of wind. So, and it's written in our books that it comes in through the neck. So therefore you'll see a lot of people wearing scarves, a lot of people that we've talked to, and a lot of acupuncturists. Because
And you want to cover up the front of your neck, or is it just a...
it's more, yes, it's around the neck, but
Okay.
it's, you know, the back.
Just the back of the
Yeah,
neck,
the
too.
back.
Can't forget about the back. And as far as treating the cold, flu, and sore throat, make sure you're wearing that scarf. It sounds like.
Yeah, it's great.
All right. Well, let's tell the audience about what programs are being offered at East West College of Natural Medicine.
Well, the college offers two programs. The primary program is a master's degree in Oriental Medicine.
Okay.
And the practitioners actually, as Dr. Caparelli would attest to, can go on and get licensed in the state. And what's that process like?
Well, we have Florida has a Great Practice Act. Our laws and rules are wonderful. We're primary care physicians. And so following graduation or even during their last semesters, most students will take their boards. There's 4 national boards
Okay.
that the students will take, and then they become licensed in the state of Florida as acupuncture physicians.
And primary care providers, and they can
Yes.
address a lot of things. We talked about it, pain management, stress, all kinds
Right. Yes.
of ailments, if
Right.
you will. And the clinic is open to the public.
Yes.
All right. And as far as the massage therapy, you have some exciting news when it comes to that.
Yep, the college is now starting a new massage therapy program. It's a 850-hour program, which is over and above the standards. So we're not just doing the bare minimum. We're actually addressing a very broad range of modalities and
Okay.
treatment types in the program. They meet and exceed all state licensure requirements.
And how long does a typical program last?
It's going to last anywhere from a year to a year and a half.
Okay.
It just depends upon, if the student's going full-time, it'll be less than 1 year.
All right.
It's 850 hours does not typically last more than, 6 to 8 months.
Do you typically get some students who are working full-time and just maybe trying to change careers or
A lot
just
of
get an
times,
education?
yeah, a lot of times this is a second career approach for massage therapy. Individuals who are coming out of the medical field, or they're coming out of perhaps personal trainers, a lot of times people who maybe have worked in physical therapy. They want to involve this type of approach because it is much more hands-on, more holistic. But we also get a lot of young people who come straight out of high school looking for that first step
Yeah.
into the allied healthcare.
First career, and we are almost out of time, but let folks know where to get more information if they
Absolutely.
want more on East West College of Natural Medicine.
The website is www.ewcollege.edu. We are at 3808 North Tamiami Trail here in Sarasota. And the phone number is 941-355-9080. So please stop by. We also have a clinic that's open through the end of the year. We have gift certificates available for treatments. And also, if you simply would like to come in and take a look at the facility, by all means, we'd give you a tour. We'd love to show you our college and sort of explain the programs in more detail.
All right, well, thank you so much for joining us for Local Doctors on Call, and that's going to do it for this edition. We'll see you next time.